change, you're going to have fear. And there are going to be changes at Pennock. I think that this is more of a market extension for Spectrum, so they're not going in and buying out a direct competitor. The positive side is they hope that they will get efficiencies. They'll be able to use the buying power of Spectrum, Spectrum's expertise to increase service and make things run better down at Pennock. The other hand, the big worry, we see all these mergers and acquisitions across the country, is that they consolidate services. And that ends up having less competition, which can raise prices and reduce choices for customers. This one, in my gut, I'm not as worried about it as if it was two big hospitals in one city coming together. That would be an issue. But here, they don't appear to be really direct competitors. It is a situation where Pennock is a very small healthcare system. They need to get the economies of scale. They need the expertise that a larger, outstanding health provider such as Spectrum has and can bring to the table. So I think there's a lot of positives that could come out of this one. Normally there are layoffs. Given this is an extension, they're kind of moving into a new regional area, we might not see mass layoffs, especially if they're committed to keeping a facility there. But there will be some job losses. You don't need two chief executive officers. You don't need two heads of IT. And that's part of the consolidation that's going to give them some cost efficiencies. A big thing is many of the systems and technologies they need are very, very expensive. You need to have a lot of patients using them. So you have to hit at least a critical size. If you're going to have an X-ray, a state-of-the-art X-ray machine, it's going to take a certain number of patients flowing through that to make it cost effective. A lot of the smaller hospitals wouldn't be able to compete. Also, with some of the new things that are needed with reporting requirements and with healthcare that's united across different specialties, you really need a scope of services that a larger provider will provide. The downside, again, is if you get too much concentration, some companies can get fat and lazy and be like traditional monopolies. Here, I'm not as worried about that. This is an organization that Spectrum's taking on, which is less than 1/20th of their size. They appear to understand this organization. They've worked with Pennock in the past, and so the hope is they know what they're getting into. There's going to be integrating computer systems, integrating HR policies, integrating a variety of things, but we hope that the power of investment kind of that Spectrum has and to leverage things over a wide variety of resources will prove beneficial overall. That's the hope.